Traditional general practice is being disrupted by medical technology and innovation. On one hand, that may seem confronting and challenging, but on the other hand, huge opportunities await. What are the medtech revelations currently available in healthcare, and do they offer real value for patients and clinicians? I'm here today at Melbourne University with Zoe Callister Hakewill, creator and host of the MedTech podcast, Behind the Medicine Cabinet, and a passionate medtechie at heart. Zoe, here we are in this amazing medical history museum. How important do you think universities are when it comes to driving medical innovations?
I like to think that universities are the seed of driving medical innovation. There's so much great research coming out that's then being commercialised and being translated for patients to use and embrace in their day-to-day lives. It's fantastic.
It really is. It's exciting. It feels like there's a lot of energy in medical innovation at the moment,
Absolutely.
particularly coming out of Australia.
Yeah.
Let's go and have a look at the old pharmacy. How good is this place? It's just amazing.
Yeah, it's incredible. Do you need some Belladonna over here on the shelf?
That's exactly what I've been after. Now, when it comes to pharmacy and medication, can you tell me about some of the innovations on the horizon in the medtech space?
One thing that comes to mind is MedMate. Basically, access to over 1,000 pharmacists. You get medication delivered to your door under 60 minutes, really prioritising the consumer experience and increasing the accessibility of medications, which is great.
Now, you told me that it was a little bit like Uber Eats, and you had me at that. Yeah. It really is really simple technology, and it makes sense because patients are sick. They don't want to have to go out to get their medication. Medication that comes to you is just such a great solution. Talk me through telehealth, because this is the real buzzword in medicine all throughout COVID. What are your views?
I'm a real advocate for telehealth. I think it's given access to people who don't usually have access to medical professionals or allied health. And CoView, the telehealth platform that has allowed a lot of patients to still have that continuation of care, even during the lockdowns and isolation. And it's a really great platform to bring all medical professionals and allied health together to really focus on the treatment of the patient. I also really like the fact that they have a virtual waiting room. It's basically as if you were to go into a general practice, sit down and have that experience with your normal doctor, except virtually.
I'm also a huge fan of telehealth. My patients have loved it because they don't have to take the day off work, they don't have to find a car park just to go and get a prescription or just to have a checkup when in fact they're completely fine. As a parent, I'm really keen to hear your thoughts about ResApp.
It's like a Shazam. Have you heard of Shazam?
Of course I've heard of Shazam. Yeah. I love Shazam.
Yeah. So it's a bit similar. So it uses pitch, tonality, sound waves to diagnose a cough. So it can pick up and diagnose chronic diseases such as asthma, chronic obstructive pulmonary disorder, but also more acute disorders of the respiratory tract, such as, the common cold or viral coughs or pneumonia.
What an amazing idea. I really love it. I think every parent in the world who potentially has a child with a cough or a cold are worrying. Is it asthma? Do I need to take my child to hospital? So I can't wait to see that really widely adopted. So tell me about another one, CNS Dose.
CNS Dose was born out of the idea that patients on mental health medications are having negative side effects associated with those medications. So really simple concept, swab inner cheek, goes off for genetic analysis, and then a report gets sent back to the clinician, which recommends appropriate medications and dosages of those medications. Making sure that the treatment is specific for the individual, really removing that idea that one size fits all, and really taking into consideration the blood-brain barrier and the individual physiology of each person, which is fantastic.
So I believe that there's a very nice speech pathology solution that brings speech pathology into the home as well.
Yeah, so Spokel, they're doing some amazing things. They have over 400 different activities that are sort of play-based, and it's a really fun way, an interactive way, and you can track the child's progress and send these results to clinicians. Then clinicians can have real-time results to assess how they're going, which sometimes what can happen is if you see a clinician, it's always in isolation or in situ, and that there's many factors that can influence a child and how they perform in that particular circumstance. So having that sustained recording over a long period of time is more valuable for a clinician to make decisions around their continued treatment and care.
What's your advice for people who are a little bit anxious about adopting these new tech solutions?
Yeah, well, I guess my first advice would probably be fair enough. I'd say, cut yourself some slack, but also be open to the experience. I think education is key, and researching and reaching out and communicating with other clinicians and reaching out to the actual technology companies themselves and saying, hey, I want to learn a little bit more about this. Can I have a trial? A lot of them will offer a free trial.
I think we all have a lot of homework to do after speaking to you. There's so much we need to look up and learn about, but it's such an exciting space. Zoe, thank you so much for your time. It's been an absolute delight and a pleasure to speak to you today, and we can't wait to see what's next on the horizon.
Thanks, Bronwyn. Really appreciate it.